Hey everybody, I'm Dr. Seiler from Seiler Skin, and we're going to do some cool treatments on one of my favorite patients here today. About a month ago we did a little bit of Voluma in her cheeks to kind of lift her up. We put a little bit of Juvederm around her mouth and the corners of her mouth. We also put a little bit of Botox in her lip to help kind of get her lip to show a little bit better, which she was really happy with. She's got great volume in her lips, so she doesn't really need a lot of injected volume because she's got a lot of natural volume. We're going to do a little bit more Botox in her lip today just to get it to show a little bit better. And then we're going to use a newer product called VOLLURE, which is a really good thinner filler in the Juvederm family for under the eyes. She's got just a little bit of volume loss under the eyes that we almost completely corrected with the Voluma, but now we're going to come back and do a little touch-up. And she was telling me earlier before we got started on this that she still sees a little bit of kind of wrinkling and pinching kind of at the corners of her eyes right there. We put some Botox in what we call the crow's feet, but I'm going to put just a little bit of Botox there just to kind of fix that, and that will help to kind of open up her eye just a little bit. So why don't you tell us what you told us earlier about just what you've seen and kind of what you wanted us to kind of finalize and touch up today?
Well, some of the issues I've always had, it's been my trouble areas under my eye. I've always had just this deep hollowness here, which can, definitely in certain lighting, it can make you look very tired because it looks dark, and it's really not necessarily even dark circles, it's just a depression there. And so when light hits it from angles, it can just look like these giant circles. So I found that with filler, it does help fill that in, and basically not only helps you look more youthful, but it also helps you look more rested, because I find that I always look tired and people are like, why are you so tired? And that's like probably 99% of my problem. So I totally recommend doing this. It's very helpful.
We fixed most of that with VOLLURE, with Voluma, because Voluma is a thicker filler that can go deep. The beauty of using VOLLURE under the eyes is that we can go both deep and superficial. So if we don't completely correct it with one of our thicker fillers that has to stay deep on the bone, we're going to come back today and do just a little bit more superficially and fix her up, and I think that'll make her perfect. And then if we have a little bit of the VOLLURE left over, it's great for putting in the corners of the lips. She really doesn't need volume in the middle. We're going to kind of fix that with Botox, and then we'll kind of touch all that off. So, all right, so we've prepped the skin under the eye here, and you can see that Chelsea used our little vessel viewer to help me see if there's any little bitty blood vessels. I'm going to do a little stick right here. You can see that I can go deep with this, and that way we can kind of fill the tissue that's under the skin, get under the muscle there. I'll do a little aspiration just to make sure I'm not in the vessel. You can see she's tolerating this fine. We actually have not put any numbing on her at all. We haven't done any topical or any injection numbing, and she's tolerating just fine. This filler has a little bit of lidocaine in it, so it really helps to numb the skin once we've done the first little stick. And under the eyes tends to be a more risky area for bruising, but now that we've got that little vessel viewing device, my risk of bruising under the eye is very, very minimal. Do you feel that much?
Yeah.
Not too bad, a little pinch.
It's fine, just a little pinch.
And the cool thing about VOLLURE as opposed to the thicker fillers is it doesn't swell at all. It doesn't absorb water hardly at all, maybe 2-3%. And so pretty much what you see is what you get, so they don't have a lot of swelling afterward. And again, like I said, I can put it both deep and shallow. So this really helps to just fill in this little bit of area that she was talking about that she's always kind of seen. And the filler is still thick enough to give you some tissue thickness so that it reduces that shadowing of the loss of volume under the eye, which is really one of the reasons why somebody can have what we call dark circles. Sometimes it's pigment, which obviously this won't correct. And then the other cool thing about this is that this little area really close to the nose bridge, the corner of the eye, is a more dangerous area to inject, especially with a thicker filler. But now that we have this thinner filler, if you know what you're doing, you can inject about right here and you can really push it up. All right, let's look again with our... Okay. All right, and I can see where my little blood vessels are so I can avoid them. And what I can do here, a little pinch, so I can put this kind of a medium depth injection, so I'm kind of elevating the tissue a little bit until I see my little bit of volume go in, and then I can actually wash that right into the area that's more dangerous to inject, so I don't have to inject that directly. And then I fill that out really nice, and you see she's not bleeding at all from it. So as opposed to most patients being scared that this is an area where they're really going to bruise, usually they don't have any problem with it. Last little thing that we can do with this that you really can't safely do with the thicker fillers is you can go a little bit more laterally on the eye. All right, let's ice right there for a second. This is an area where you don't have near as thick a tissue, and so if you put one of your thicker fillers there, it's a little bit harder to make it not be palpable where they can feel it. But you can see that she's got just a little bit of volume loss out there. You see a nice big blood vessel right there, which is great, so that we can see it and I can avoid it. All right. I'm gonna do one more little stick out here. You can see if I do my little wiggle, usually they barely even feel it. Now I can put a little bit of filler right there, and that'll pop that out real nice. And we don't have any bleeding, so good. So I've only used about 1/4 of a syringe. A little bit goes a long way if you put it in the right spot. So what we'll do next is, since she wanted just a little bit more volume in her lip so that we don't have to open up a separate syringe, let's ice right here in the corners of her lip. We'll be able to put the last little bit of it right there and avoid her from having to have 2 different syringes, because even though Juvederm gives you more volume in the lip, Volure still will do a nice job, even though it's a little bit thinner, and she really doesn't need too much volume in her lip. So let's go up just a little bit here. And you'll see that what we'll be able to do is pop this little corner. All right. Okay, good. And again, I use my little, and again, we haven't done any numbing. A little poke here. If I do my little wiggle like that, they barely even feel it. That little movement kind of just distracts the brain from feeling pain. And pop that corner out real nice and kind of massage a little bit there. And once she sees this kind of fill in and really become part of the tissue, that'll give her that last little bit of flip to the corner of the lip that we need. And that's it. So we put a little bit of filler under her eye there, a little bit in the corner. We'll give that a couple of weeks to really kind of settle in and kind of thicken the tissue and everything, and she should be really happy with it.